I'm a nurse researcher in the area of symptoms and conducting research, and then also teaching nursing students in bachelor and master's programs with focus in oncology. Well, oncology nursing takes into consideration all patients who have some form of cancer. That is about 1.5 million patients are diagnosed every year with cancer. And those cancers could be hard tumors or solid tumors such as breast that we're familiar with, lung, colon. But it also is those liquid tumors or blood tumors that we're familiar with, such as your leukemias, your lymphomas. So an oncology nurse would care for anybody that has, and it's also important to point out, had cancer, because we have about 11.4 million Americans who are cancer survivors. So we don't want to leave them out when we talk about oncology nursing. Well, very interestingly, when I was in elementary school, I had an aunt, my father's sister, who suffered a very rare form of brain and lung cancer and subsequently died. And I remember how difficult it was for all of our family, but particularly for her two children, who are my cousins, were my same age. And from that point forward, I had always been interested in working with patients with cancer. I then eventually went on to become a nurse, and I have done just about everything in nursing. Interestingly, in my 20 years as a nurse, I've only worked with patients with cancer. Of course, cancer affects basically any human being, whether it be an infant all the way through to the very oldest geriatric population. So in oncology nursing, it would not be uncommon that you may have a nurse who would specialize, let's say, in pediatric. You certainly have your geriatric patient. I always tell all of my students, cancer in reality is really a disease of older people. You certainly see younger people that do have cancer, but in majority, when you look at the numbers, it's really a disease of older people. So there's always a focus in geriatrics as well. So we basically say from birth up until death. The opportunities within oncology nursing are just incredible. And the beauty of nursing, I think, is that you can skip around. You know, if you're a Spanish teacher, it's likely you're going to be a Spanish teacher for the rest of your life. But if you want to work in nursing, you can do basically anything. And you know, we're certainly seeing more nurses who are really starting their own businesses, or so there's certainly a business sense and also a health policy. You know, if you are interested in working within the federal government or going into DC to make the case for patients and families with cancer. So incredible opportunity. A nurse that's working, let's say, in an adult oncology unit could be doing administering chemotherapy. They could be caring for somebody that has a particular symptom that day, let's say nausea and vomiting. It could be a psychological approach. You know, sometimes patients need blood, and so a nurse may be administering blood. Maybe a patient may have infection, so they may be giving chemotherapy. There's also this essence of a presence of the nurse with the patient and family with cancer. Unfortunately, physicians are very busy. They come in and they see the patient very shortly, maybe once or twice a day, but it is the oncology nurse in the inpatient setting that is virtually with the patient 24 hours a day, always there for the patient. A nurse has got to have great assessment skills, so to be able to connect the dots almost. I learned there very quickly to listen to patients and what they're saying, even when it was improbable that that's really what was going on with the patient. You see something once, and then after that you will always remember, but you really do have to have good physical assessment skills, so being able to listen to a patient, so you're right, you do have to have good assessment skills, and those grow the longer that you're in nursing. Nursing is the kind of thing that you have to be able to know when to be quiet, to be able to, for a lot of people, there's always this, I don't know what to say to the person, or I don't know how to answer the person. And we certainly have learned in nursing research that just being with a patient, it often is really all that they are really asking of you. Good clinical skills, good communication skills. The patient that walks in the door may have a sixth grade education, and the next one may have some form of doctorate. And so you've got to be able to assess who's standing before you and be able to communicate in a way that they will understand. You've got to be a team player. There's not a lot of fun working in a team when one of those persons is acting out or not pulling their weight. Nursing is a hard job, so you've got to be able to be a team player, and you have to have some thick skin, because sometimes things are difficult working with patients. Sometimes patients may say something to you, or a nurse may say something to you that you can't really let it hurt your feelings, and you have to really enjoy doing what you're doing. Well, I would tell them that, at the Oncology Nursing Society, we do invite high school students into our local chapter meetings, because we have local chapters of nurses who meet every month, and invite them in and let them start meeting other oncology nurses. And then, for a high school student, if they have opportunities in the summer to do some kind of volunteer work, but there certainly are incredible opportunities for high school students, once they do get into nursing school, to really push their college nursing professors to give them rotations in oncology. So every nursing student spends many, many hours of clinical time during nursing school. And if you think that you have an interest in oncology nursing, then ask that you be put on oncology floors in oncology clinics, maybe traveling with a hospice nurse. That would probably be the best opportunity. There's been really a tremendous change, and you can't go away from oncology nursing, I don't think, and come back 5 years later and think that the whole field is the same, because it isn't. It's the good news is that every day we're finding great treatments, chemotherapy drugs that work better in conjunction with each other. All of these technologies, all these different treatments, as I said, have side effects that come with them, and it's the job of the oncology nurse to keep up, keep educated. So it is an ever-changing field. Ideally, I would like for us to be able to find a cure for cancer, and I would like for all of us to be put out of a job. That would be very pleasant, very pleasant. Until that happens, I think the future of oncology nursing is going to be that we are going to continue to travel along with those researchers and physicians who are finding the best new care or best new approaches for chemotherapy. I think we're going to see those survivorship numbers increase. People are living longer and older, longer and longer. I think that we're going to see more and more cancer. I think that we are going to, because people are going to live longer, and I think we're going to have many, many more survivors. And I can see where nurse practitioners will be running survivorship clinics very autonomously on their own, because there's not enough oncologists, physicians to take care of all of the patients. So I think that we are going to see new technologies. We're going to see cancer survivors live longer, and I think that we're going to be busy for years to come until we find a cure for cancer. The only thing that I would add is that the Oncology Nursing Society, we have 37,000 members, but more importantly, we have an incredible website where if you're a nurse, if you're a patient that's looking for information about cancer, and it's www.ons.org. That's www.ons.org, and there are incredible opportunities there, information. You can get connected with somebody that can help you to find the information you want, either about cancer or about oncology nursing.